Japan is an island country off the coast of Asia. It is made up of over 6,000 islands and has a population of 127 million. Their capital, Tokyo, is one of the most populated cities in the world. Japan is an economic powerhouse with their GPD being the third highest in the world. They also place great value on education and are one of the world's most literate countries.
Japan's culture plays a vast role in them living a healthy lifestyle. To begin, sports are a big part of Japanese culture. From traditional Japanese sports like sumo wrestling, karate, judo, and kendo to more modern sports like baseball, soccer, and rugby. Kids begin these sports at a young age and continue staying active throughout their entire life. Another tradition that affects their health is their multi-generation households. In Japan, a typical household is 3 generations deep. This has many health benefits in itself. Living with your elders, you are able to take care of them and help them on a daily basis. This helps people live longer, healthier, and happier lives. The Japanese take pride in careful preparation into their food and meals. Food is an art even down to their simplest dishes. White rice is an element of almost all meals in Japan, and other ingredients include soy products, grilled or raw fish, tofu, bean sprouts, and vegetables. All of these traditional delicious foods are low-fat, low-carb diets that are known for their heart and healthy benefits. This is a big promoter in their overall health as a country.
Japan has good health statistics as they are ranked first in the number of hospital beds per person for their population. They have 14.3 beds per 1,000 people, which is 4 times more than here in the United States. They are ranked second in infant mortality rates with only 2 deaths per 1,000 births. Japan also has super low obesity rates, with only 3.2% of the population being obese. Lastly, they have the fourth highest life expectancy, being 81 years for males and 87 years for females.
Now, an introduction to Japan's healthcare system. The government controls and regulates nearly all aspects of healthcare in Japan. The system is organized with the Ministry of Health, Labor, and Welfare as the leading organization. They set the standards and regulations for the entire healthcare system.
The Japanese government provides universal health insurance to its citizens. The health insurance pays for about 70% of the cost, and the rest is paid by the patient through a copayment. If you are employed, you receive whatever health insurance your employer provides, and you and your employer split the cost of the premiums. There is government aid available for those who are unemployed. Insurance in Japan cannot deny any person or any claim. As previously mentioned, patients must pay 30% of their healthcare bills, and their insurance pays the rest. However, this is capped at $650 per month. If a patient's portion of the bill exceeds $650, the remainder of that cost will be covered by insurance. All citizens must have insurance, and failure to pay premiums is against the law, but those who struggle to pay premiums are not left in the dust. The government provides aid for small companies and for those who are unemployed or retired. If a citizen is below the poverty level, the government will pay that citizen's entire insurance premium.
The National Allied Health Insurance allows citizens to have access to any and all healthcare facilities with or without a referral. Overall costs are much lower than other countries due to the government setting prices. Japan has extremely high utilization rates with same-day appointments being the norm. They have particular high usage of CT scans and MRIs as they are favored by the population. One drawback of people having such easy access is that services are sometimes overused. There is no maternity insurance coverage, but most mothers can receive grants from the local government to cover the cost. Japan focuses on preventative medicine, so they provide free yearly physicals for all citizens.
While it is possible for people who hold an undergraduate degree to enter into medical school, nearly 90% of medical school applicants come directly out of high school. A typical med school in Japan lasts 6 years, consists of 4 years of preclinical education and 2 years of clinical work. As a whole, healthcare providers are trained very similarly to those in the United States. The main difference between the two occupations is pay. In 2016, an average physician in the United States was paid slightly over $200,000, while an average Japanese physician made just about half of that. Yet Japanese doctors are just as satisfied as doctors in the United States, with both countries having stats saying about 50% of physicians are satisfied with their current position. These similar satisfaction rates allow more healthcare money to be invested into the patients rather than the providers, thus allowing a more efficient healthcare system to be developed.
Eureka Izumi is a foreign exchange student from Tokyo. She's only been in America for a few months, but so far she believes that the American healthcare system is much more complicated than Japan's. She states that there are shorter wait times in Japan, and you only have to speak to one healthcare provider during your visit.
It's so easy, and when we have some troubles, like when I get cold, we can go to see the doctor, but it's kind of difficult to go to a big hospital.
Yeah.
It's like more emergency thing, but we
Okay.
can easily go to the clinic.
Okay.
We pay at the front desk, and we can pay with cash or card, and it's only like 30% we have to pay, and the rest of them are covered.
Okay.
And when we like get surgery or other kind of specific thing, we have to use other insurance. And it was kind of difficult, and the time we wait to see the doctor was too long. It's so stressful. Like in Japan, it's usually in like 1 hour.
Oh.
Yeah, I have to talk to many medical people,
Yeah.
like why I came to the hospital.
So you didn't just tell one person.
Yeah.
A nurse came in and a doctor came in.
Yeah.
Yeah.
It's so complicated. Yeah, and I didn't know where to go.
Oh yeah. It's
Like,
confusing.
Yeah, and sometimes they left me somewhere. Like
Yeah.